You take a pill to help you sleep. You take a pill for seasonal allergies. You take a pill for a leaky bladder. On their own, each of these seems perfectly harmless, but combined, they are accidentally causing a chemical traffic jam in your brain that closely mimics Alzheimer's disease. If you or your parents are experiencing sudden memory fog, the culprit might not be aging. It might be the medication sitting in your nightstand drawer right now. I'm Dr. Marcus Thorne, a geriatric specialist, and in my practice, I see this happen almost every single week. A family brings in their mother or father, terrified that dementia has set in. But when we look closer, the problem isn't their brain. The problem is a massive, invisible overlap in their medicine cabinet. By the end of this video, you are going to know exactly which common, everyday pills are secretly draining your memory. You'll learn how to spot this dangerous overlap, and most importantly, I'll give you the exact words to use with your doctor to safely get your mental sharpness back. Before we dive in, I want to ask you a quick question. Have you ever walked into a room and completely forgotten why you were there, or struggled to find a word that was right on the tip of your tongue? Let me know in the comments below. We've all been there, but when it happens constantly, it's terrifying, and I want you to know you aren't alone. Let me tell you about a patient I recently cared for. We'll call her Eleanor. Eleanor is a 72-year-old retired school teacher from Phoenix, Arizona. For years, she was the sharpest person in the room. She managed her family's finances, never missed a birthday, and still did the Sunday crossword in pen. But over the course of about 6 months, everything changed. Eleanor started forgetting where she put her keys. She left the stove burner on twice in 1 week. She became confused driving home from the grocery store she had visited for 20 years. And then, the terrifying moment came. She suffered a bad fall in her living room. Her family was heartbroken. They assumed, logically, that this was rapid-onset dementia. They started having quiet conversations about assisted living. They thought the mother they knew was slipping away forever. When Eleanor sat across from me in my clinic, she looked defeated. But before we talked about memory tests or brain scans, I asked her to do something I ask all my new patients to do. Dump everything you take, every prescription, every vitamin, every over-the-counter pill, into a brown paper bag and bring it to me. So, when we emptied Eleanor's bag onto the examination table, the puzzle pieces immediately snapped together. Her cardiologist had given her 1 pill. Her urologist had given her another for an overactive bladder. Years ago, her primary care doctor prescribed an older medication for nerve pain. And because she was having trouble sleeping through the night, Eleanor had recently started picking up an over-the-counter PM sleep aid from the local pharmacy. None of her doctors knew what the others were prescribing, and nobody at the pharmacy checkout counter stopped to ask what else she was taking at home. Eleanor didn't have Alzheimer's disease. She was suffering from severe medication overload. To understand why this happens, you need to understand a little bit of basic brain chemistry. Don't worry, we're not going back to medical school. Just picture your brain as a massive, bustling city connected by a high-speed internet network. The chemical that runs this network is called acetylcholine. It is the messenger responsible for your memory, your learning, your attention, and your muscle movements. As long as your acetylcholine levels are strong, your brain's Wi-Fi is fully connected. You think clearly, you react quickly, and you remember where you put your glasses. But as we get older, our natural production of this vital chemical naturally slows down. The signal gets a little weaker. That's normal aging. Here is where the danger comes in. Dozens of common medications, both prescription and over-the-counter, belong to a class of drugs called anticholinergics. And so, you don't need to memorize that word, but you do need to understand what it means. It means they actively block acetylcholine. Every time you swallow one of these pills, you are essentially walking over to the router in your brain and unplugging the high-speed internet cable. You are cutting the communication lines. Now, if a young, healthy 30-year-old takes one of these pills for a few days to clear up a runny nose, their brain can handle it. They might feel a little groggy, but they bounce back. But when you are over 65 and your natural acetylcholine levels are already lower, and then you accidentally stack 2, 3, or 4 of these blocking medications on top of each other, the internet doesn't just slow down, it crashes. The medical term for this is the anticholinergic burden, and but I just call it a chemical traffic jam. It creates severe brain fog, intense confusion, dizziness, dry mouth, and dangerous falls. It looks exactly like dementia. It acts exactly like dementia. but it is chemically induced. And the most frustrating part is that millions of seniors are living in this fog right now, entirely unaware that the inevitable aging they are grieving is actually sitting right there in their pillbox. Let us pull back the curtain and look at the exact medications causing this chemical traffic jam. I want to give you the hit list. These are the 3 specific categories of everyday medications that are the worst offenders for silently draining your memory. The first and most common culprit is the PM sleep aids and older allergy pills. I am talking about anything containing the active ingredient diphenhydramine. You likely know these by their familiar brand names: Benadryl, Advil PM, Tylenol PM, Zizquil, and dozens of generic store brands. Millions of seniors reach for these every single night because they are cheap, they are available without a prescription, and they effectively make you drowsy. But that drowsiness comes at a massive cost. These drugs are highly anticholinergic, meaning they cross the blood-brain barrier incredibly easily. They do not just put your body to sleep, they put your brain's communication network into a chemical coma. I recently worked with a patient named Sylvia, a 74-year-old woman from Mesa, Arizona. Sylvia was dealing with joint pain that kept her awake, so she started taking a store-brand PM pill every single night to help her rest. Within a few months, her daughter noticed she was repeating stories within the same hour and losing her train of thought mid-sentence. Sylvia told me she felt like she was constantly trying to walk through wet concrete. She honestly thought her mind was failing. It wasn't. Her brain was just starved of acetylcholine. The second category on our hit list catches almost everyone off guard: bladder control medications. As we age, an overactive bladder is an incredibly common and frustrating issue, and drugs like oxybutynin are frequently prescribed to help. The way these medications work is by blocking the nerve signals that cause the bladder muscle to spasm. And how exactly do they block those signals? By blocking acetylcholine. But here is the critical flaw in that design. The medication does not know how to stay just in your bladder. It travels through your bloodstream, crosses into your brain, and indiscriminately cuts the very same chemical wires you rely on to form new memories and process information. You are essentially trading your mental sharpness for bladder control, often without ever being warned of the exchange. The third major category involves older prescription medications that are frequently repurposed for seniors, specifically older tricyclic antidepressants like amitriptyline. Today, these are rarely used as first-line treatments for depression. Instead, doctors frequently prescribe them at lower doses to help seniors manage neuropathy, chronic nerve pain, or severe insomnia. Among all the medications we see in geriatrics, these carry one of the heaviest anticholinergic burdens available. They throw a thick, heavy blanket over your brain's processing speed. When you combine an older nerve pain pill with a bladder pill and a PM sleep aid, you are creating a perfect storm of cognitive decline. You might be wondering, if this overlap is so dangerous, why isn't this front page news? Why didn't your doctor warn you? The truth is, inside the medical community, the alarm bells have been ringing for years. The American Geriatric Society publishes something called the Beers Criteria. It is the absolute gold standard reference guide for potentially inappropriate medication use in older adults. Every geriatric specialist knows it by heart. The Beers Criteria explicitly warns against using these highly anticholinergic drugs in seniors because they drastically increase the risk of severe confusion, dry mouth, chronic constipation, and terrifying, life-altering falls. The data backing this up is undeniable. Massive studies, including long-term data published in JAMA, the Journal of the American Medical Association, show that long-term use of these medications can increase your risk of cognitive decline by up to 54%. Let that number sink in for a moment. 54%. We aren't talking about a minor inconvenient side effect like a mild headache. We are talking about a drug-induced fast track to memory loss that looks indistinguishable from early-stage Alzheimer's. Take a look at your nightstand or your medicine cabinet tonight. If you see anything ending in the letters PM, drop a yes in the comments below. I guarantee you will be shocked to see how many people in this community are in the exact same boat, completely unaware of the risk. I want to tell you about Arthur. Arthur is a 68-year-old widower living in Dayton, Ohio. Arthur has always been a sharp guy who loved reading dense historical biographies, but he started having terrible trouble keeping the names and dates straight. He would read a chapter and immediately forget what happened on the previous page. Arthur also suffered from terrible seasonal allergies. Every single morning, like clockwork, he was taking a little pink allergy pill, diphenhydramine, just to stop the sneezing. He was unknowingly trading his memory for a clear nose. When we identified the overlap, we simply swapped his old allergy pill for a newer, second-generation option. Within 2 weeks, the mental fog lifted. Arthur got his sharp, analytical mind back, simply by removing the chemical roadblock. What happened to Arthur and Sylvia perfectly illustrates the core danger of these medications, the cumulative brain drain effect. This cognitive damage is entirely dose-dependent. Taking a single allergy pill once a year for a bee sting is not going to cause dementia. Your brain can clear it out and recover. The hidden danger lies in the daily, relentless use. Taking a bladder pill every morning, an allergy pill every afternoon, and a PM pill every night creates a phenomenon called medication overload. You are forcing your brain to operate with one hand tied behind its back, day after day, year after year. The burden stacks up in your system, and eventually, the brain simply cannot compensate anymore. But here is the most important part of this entire video, and the reason I want you to feel incredibly hopeful right now. Unlike the devastating progression of true Alzheimer's disease, this chemically induced brain fog is often reversible. If you take the right steps, you can turn the internet connection back on. If you are listening to this and realizing that your own medicine cabinet or your parents' medicine cabinet is filled with these overlapping medications, I need you to pause and listen to me very carefully. Do not go into your bathroom right now and throw all your pills in the trash. I cannot stress this enough. You must never stop taking prescribed medications cold turkey, and even abruptly stopping over-the-counter sleep aids can cause a massive rebound effect. Your body has chemically adapted to having these drugs in its system. If you suddenly pull the plug, you can experience severe rebound insomnia, acute anxiety, urinary retention, or dangerous spikes in blood pressure. We do not want to replace one crisis with another. Instead, we want to perform a safe, gradual, chemically supervised taper. And you do that by having one specific, highly effective conversation with your doctor. The next time you or your parent sits down in the exam room, I want you to bring that physical brown paper bag filled with every single pill, vitamin, and supplement being taken. Put it right on the table. And then, I want you to look your doctor in the eye and say this exact sentence. The Ardris. Doctor, I am very concerned about my cumulative anticholinergic burden. Can we audit this bag and see if there is any overlap we can safely reduce? That specific phrase, anticholinergic burden, is the secret password. It tells your physician that you are informed, that you are taking your cognitive health seriously, and that you are actively asking for a process we call deprescribing. Deprescribing is one of the most powerful tools in geriatric medicine. It is the careful, systematic removal of medications that are no longer serving you. And the beautiful thing is, modern medicine has developed incredible, brain-safe alternatives for almost every problem these older drugs were trying to solve. Let me show you exactly what those safe alternatives look like, so you can bring these ideas directly to your doctor. If you are struggling with sleep and relying on a PM pill, ask your doctor about swapping to a brain-safe alternative, like a low-dose melatonin supplement, magnesium glycinate, or even cognitive behavioral therapy for insomnia. These methods help your body wind down naturally without throwing a chemical blanket over your brain's memory center. If you take a pink allergy pill every single day just to stop a runny nose, ask your pharmacist about second-generation antihistamines. Medications like cetirizine, known as Zyrtec, or loratadine, known as Claritine, are designed specifically so they do not cross the blood-brain barrier. They stay out of your brain, they clear your sinuses, and they leave your memory completely intact. If you are dealing with an overactive bladder and taking a drug like oxybutynin, ask your urologist about newer classes of medication. There are drugs available today, like mirabegron, that work on completely different nerve pathways. They calm the bladder muscle without blocking the acetylcholine your brain desperately needs. And never underestimate the power of pelvic floor physical therapy, which has zero chemical side effects and can work wonders for bladder control. And if you are on an older antidepressant for nerve pain, have an honest conversation with your primary care doctor or neurologist about carefully tapering down or transitioning to newer nerve pain medications that carry a fraction of the cognitive risk. I want to bring us back to Eleanor, the 72-year-old retired school teacher from Phoenix whose family was quietly touring assisted living facilities because they thought she was losing her mind. Once we dumped her bag on the table and saw the chemical traffic jam she was caught in, we created a plan. We didn't change everything overnight. Over the course of 4 weeks, under strict medical supervision, we slowly tapered off her over-the-counter sleep aid. We worked with her urologist to swap her bladder medication to a brain-safe alternative. We carefully lowered the dose of her older nerve medication. About 6 weeks later, my clinic phone rang. It was Eleanor's daughter. She was crying. But this time, it wasn't from grief or terror. It was from profound relief. She told me, "Dr. Thorne, I have my mother back. She beat me at Jeopardy last night." In geriatrics, we call this the de-prescribing awakening. It is one of the greatest joys I get to experience as a physician. To watch the fog lift, to see the light come back into someone's eyes, and to give a family their mother, father, or spouse back simply by clearing away the chemical clutter. Dementia is a heartbreaking, complex disease, but not all memory loss is dementia. Sometimes it is just a pharmacy blind spot. You have the right to a clear mind, and you have the right to question the pills you are told to swallow. I want you to take action on this today, and I want you to make a commitment right now in the comments below. Comment the words, "starting today." If you are going to go into your bathroom after this video and audit your own medicine cabinet for overlapping PM pills, comment, "asking my doctor." If you are going to write down the phrase anticholinergic burden and bring it up at your very next appointment, and please, comment, "sending this." If you already know a friend, a loved one, or an adult child of an aging parent who desperately needs to hear this message, share this video directly with them. It might just save their independence. Make sure to save this video so you have the exact questions ready for your next doctor's visit, and subscribe to the channel so we can keep protecting your health and your mind as you age. I'm Dr. Marcus Thorne. Stay sharp, ask questions, and I will see you in the next video.